Good evening. My name is Jonathan Rusk, and I am the Secretary of the Department of Homeland Security, and I approve this public service announcement. It has come to our attention that on December 31st, 2019, China reported a cluster of cases of pneumonia in people associated with the Hunan seafood wholesale market in Wuhan, Hubei province. On January 7th, 2020, Chinese health authorities confirmed that this cluster was associated with the novel coronavirus 2019 nCoV. Although cases were originally reported to be associated with exposure to the seafood market in Wuhan, current epidemiological data indicate that person-to-person transmission of the 2019 nCoV is occurring. As of January 30th, 2020, a total of 9,976 cases had been reported in at least 21 countries, including the first confirmed case of 2019 nCoV infection in the United States, which is reported on January 20th, 2020. As of April 24th, over 2.7 million cases have been confirmed, with over 194,000 deaths across 185 countries. As of June 5th, over 6.75 million cases have been confirmed, with over 393,000 deaths across 210 countries. Now, as the Secretary of the Department of Homeland Security, what I want you to know is that the government will be working alongside you to combat this common enemy, which is the COVID-19 pandemic. So who am I? I'm Jonathan Rusk, against the Secretary of Homeland Security. And I want to tell you a little bit about how the FEMA department within our Department of Homeland Security will be assisting us with combating the COVID-19 pandemic. And part of the role of FEMA for all of us is for vaccine dissemination, resource allocation, recruitment, coordination with the state, local, and tribal governments, and with the dissemination of news and pertinent information as new and up-and-coming information arises. So what will I be doing for you? We will always be working together to enhance national preparedness. We will be working on prevention, protection, mitigation, response, and recovery. And we will always combat this pandemic until it is completely out of our fine country and completely been eliminated from the world. So what I want you to know, fellow citizens, is that there is help, and we are targeting several sectors for support. And these sectors include our healthcare workers, our state, local, tribal, and territorial governments, and how we are going to be helping you as individuals. So part of the role of the national government is to work with the healthcare workers. So we always want to keep our healthcare workers safe so that they can continue to serve us and help us through the pandemic. So how we do this is we work with the state, local, tribal, and territorial governments to assess need for medical equipment and to allocate all the equipment appropriately. Some of these pieces of equipment that we would need to allocate appropriately would include personal protective equipment and all of the testing supplies for the COVID-19 testing. We will also be working with our local healthcare workers to assess the need for pop-up facilities to alleviate burden, and this will be facilitated by the Army Corps of Engineers. To target the state, local, and tribal and territorial governments, what we will be doing with them is, in addition to working with these government agencies, we will work with other volunteer agencies in the private sector. And what we will do with them is we will provide some guidance and provide guidelines as they become available regarding the pandemic. So I would refer everybody to the COVID-19 Pandemic Operations Guidance Manual, which is the national manual for the most up-to-date information on how we try to combat this epidemic. We will also be providing financial support at the government level, the state, local, tribal, and territorial government levels. We will also be assisting these government agencies with vaccination planning and with resource allocation and access to the National Guard when needed for additional resources. And then finally, on the individual level, we will be assisting with the food and feeding, making sure that everybody is healthy and active. We will be assisting with any housing needs. We will be assisting with small business and economic resources as they become needed. We will be assisting with a coordination with the rural and agricultural sectors to make sure that all of our needs are met there. We will be assisting the schools and daycares to make sure that our children are healthy and that they continue to be able to return to their schools. And we will be assisting with healthcare resources. So we will be assisting you as you may need it with mental health support, crisis counseling, or any other needs as they may arise. And we will try to make sure that to minimize the effect to our arts and culture and make sure that they remain thriving throughout the pandemic. So you may be asking how you can help. And there are some key ways here that you can help on a personal level. So if you've already been infected with the virus, we would ask you to please assist with the donation of your plasma to help keep other people healthy. You can serve as a medical reserve volunteer, and we would be able to allocate your assistance where it's needed. You can give money or non-perishable goods so that we may distribute them to anybody who may need it. If you own a business, you can assist us with the distribution of medical supplies, and you can assist with research and development of diagnostics and therapeutics as we continue to work to fight the virus. And if you have any other additional questions, I would like to direct you to the coronavirus COVID-19 website at the Department of Homeland Security here at dhs.gov. And I want you all to know that we are all in this together, and we will continue to fight until we end the pandemic in this country and throughout the world. Thank you.